So I'm sure everyone has seen the movie Step Brothers when Dale and Brennan walk down to the kitchen in the wee hours of the night, and one is throwing things in the cabinet, breaking things, shaking the coffee, drinking the coffee beans, stuffing the pillows in the oven. So I'm here to just kind of dissect why they did that, what caused them to do that. Not just Step Brothers, but in general. What is sleepwalking? So sleepwalking, the definition is to walk around and perform other actions while asleep. So sleepwalkers usually perform activities that they would in their regular consciousness while they're unconscious. So for instance, going to the bathroom, you do that when you're conscious, so you might do that when you're sleepwalking because you're unconscious because you're used to that behavior. So activities while sleepwalking can be really benign, such as talking, sitting up in bed, sitting up at the edge of the bed, going to the bathroom and cleaning, or they can be as serious as cooking, driving, violent gestures, grabbing at hallucinated objects, or even homicide. According to Kale's 1980, he says that sleepwalkers often have little to no recollection of behaviors performed while they're sleepwalking, because usually this is performed during REM sleep, so you have no recollection or can vaguely remember what can happen. So you can remember maybe waking up on the couch, but you can't remember what you did to get there. So what does sleepwalking look like? If you've never seen anyone that sleptwalk, they usually have a glazed face, very dim look. Their eyes are open, however, but they look dead. I mean, they're unresponsive, but they're just, their eyes are open, but it's just a very dim, glazed over look. So how long does this last? According to Bassetti in 2000, he says that as early, or sleepwalkers can last up to 30 minutes or as little as to 30 seconds. It just depends on the person. As I mentioned, it occurs during REM sleep, and it usually occurs between the times of 10 p.m. and 1 a.m. in the morning. So this arose a question, what are the main causes of sleepwalking, and is there any significant differences between adults that sleepwalk or children? So according to the 1999 article by Maurice O'Hyan, he proposed that some causes of sleepwalking could be triggered by fever, medication, drugs, or stress. So this leads me to a personal experience. I sleepwalk all of the time, like a few times a week. And I remember my roommate telling me lots of stories about sleepwalking. I would yell things, I would get up and walk around the room, I would get up and brush my teeth, because I did that when I was conscious, so I did that when I was unconscious. I never remembered any of it, but she had videos of me sleepwalking, brushing my teeth, and yelling at her, and which is scary. Also, fever. When I get a fever, I get night terrors, which is also like some form of sleepwalking, which can actually lead you to the more serious stages of sleepwalking, like that can lead to such serious things as homicide. So, differences between adult and children. PubMed published a study on adult sleepwalkers and parasomniacs. A parasomniac is just someone who suffers from night terrors, sleepwalking. So they found that all adults who sleepwalk or even have night terrors may be suffering from some sort of mental disorder, such as schizophrenia, hysteria, or anxiety neurosis. An article in 1986 by Berlin stated that sleepwalking is an unusual disorder and it varies considerably by age. So even though adults can sleepwalk, it's not unfrequent for adults to sleepwalk, but it occurs more frequently when children sleepwalk, or teens that have yet to reach puberty. Those are the most prime times for people sleepwalking. So how can we prevent sleepwalking? Is there any way that we can prevent young children or even adults from sleepwalking? So according to the 1997 article by Journal of Pediatric Psychology, written by Natalie Frank, she states that one way to prevent sleepwalking is to actually wake up the sleepwalker before they begin sleepwalking. So as I mentioned, that sleepwalking usually occurs between 10 p.m. and 1 a.m. So to wake up the sleepwalker before their usual time, so anywhere between that, to basically wake up the person before they sleepwalk will stop it. It seems kind of stupid because obviously if you wake up a person, it breaks up their REM sleep, then they have to fall back asleep. So this is actually proved almost 100% accurate because she did this on 3 kids that sleepwalk frequently, and what she found was that that waking them up during that duration of time, that they actually did not sleepwalk anymore. So in conclusion, sleepwalking varies in age. It is more common in children, but it still occurs in childhood. Many possible causes of sleepwalking I call natural, such as like fever or stress. Those are things that happens naturally in our body. So, or unnatural, such as drug abuse and medication. We can stop those things, which can stop sleepwalking. So now that we have a further understanding of sleepwalking, we may know why Dale and Brennan maybe ventured off to the kitchen at 1 a.m. Maybe because they were stressed, because they had to move in together, or because they were abusing drugs.